Hello everybody, I'm Dr. Mamtha, practicing in Bangalore. I thank Dr. Kalatia, our great master, for giving me this opportunity in this amazing journey of online repertory training course. Before I start, I want to share a quote by Albert Einstein: "Never stop learning because life never stops teaching." As we know all, our materia medica is vast and it's difficult to memorize all the symptoms. Exactly for this very reason, repertory was introduced by our great masters. Here on, I'll talk about how materia medica is useful in selection of specific medicine after repertory session. In some cases, we'll get more symptoms with modalities. And after repertory session, at times, 3 to 4 remedies covers all symptoms with equal gradation. At times we have a little confusion which remedy to give. In such case, we have to confirm or recheck with our materia medica before giving the specific remedy to the patient. The specific remedy is nothing but the core of the patient should match with the core of the remedy. The genius of the remedy. And if the patient comes or in severe pathological conditions, the patient comes with very few symptoms common to a disease. We are not getting any PQRS or any specific modalities. In such case, after repertory session, confirm with our materia medica before selecting the specific remedy. Or we can select the organ specific remedy in our repertory chart to prevent the further complications of our patient, or in acute exacerbations of a chronic case. At times, our selected constitutional remedy may or may not be in our repertory chart. In such case, we have to confirm with our materia medica for acute prescriptions. So, we will understand this with a case example. Why materia medica is important in selection of remedy even after repertorization. It's a case of a female of 35-year-old. She came with a presenting complaint of severe pain and swelling in mammary glands, and she was suffering since 1 year. And she's feeling heavy and discomfort while walking, and pain more before and during menses, and best pain better after menses. And she could not bear any jerks, even she could not walk. And she came with a restless speech that she was telling, and she was narrating with a restless speech, and she says having that much pain, and she even touch aggravates the pain, and she could not bear any jerks even while riding on a bike, and her menstruation was very painful and too profuse. And because of the extreme tenderness of the patient, I could not examine thoroughly, and however, I could elicit through the patient's history that there is no hardness of breast. So I asked the patient to tell little bit detail about yourself and your pain and all. And she told, "Doctor, I am having severe pain. I'll come in the next visit. I'll explain you all that time. Right now, give some medication to relieve my pain because I have been treated for the past 1 year with allopathic and homeopathy doctors without much relief." So I just went to the Fatak repertory and few of them we follow Patak Repertory for the acute cases. And I went to the Patak Repertory, and in that I searched Mame heavy rubrics which I took from the Patak Repertory. Mame heavy, Mame sore, painful, Mame menses during aggravation, Mame menses before aggravation. On repertorization to the Patak Repertory, I got lac caninum, phytoleca, conium, bryonium, all these group of remedies. And out of this, lac caninum and phytoleca covers all four symptoms. So now the question comes here to me, which remedy to give to this patient? And she is not, right now, she is not interested in telling all the details about herself or what are the problems, what are the issues in her life. I could not elicit that at that time. So I went in search of materia medica and I took Allen's. In Allen's, Phytoleca, it's written stony, hard, painful mame, painful nodocytes. And in Bryonia, mame, heavy, stony hardness must support the breast. And in Conium, stony hardness of breast, painful before and during menstruation. And in lac caninum, it's written inflamed, painful, aggravation by Lee's jar. Hold firmly when going up or downstairs. Breast swollen, painful, sensitive before and during menses. And even in boric, it is written inflamed, painful, aggravation by Lee's jar. And even in Fartak materia medica, in lac caninum, you can see that there is a swollen, painful, heavy, and aggravation by Lee's jar and menses profuse. So, on referring these three materia medicas, I came to the conclusion to give lac caninum. I gave her lac caninum 203 doses for 3 days, followed by SN 7 days. After, after 10 days, she came with a very smiley face. Doctor, right now I'm 95% better. I'm so thankful to you like that. And even without taking a detailed case history, I can come to the conclusion after repertorization with the reference of materia medica, I can give the remedy to the patient. I can give the exact remedy for the patient. So the genius of the remedy, not only the keynote symptom, the genius of the remedy, even organ affinity of the remedy, themes and kingdom analysis also plays an important role in selection of specific remedy even after repertorization. We'll understand this with another case example. This is a case of a hypothyroidism with PCOD. Female of 23-year-old. She came with the presenting complaints of heavy flow during menses that lasting for 7 days. And she's having itching in vagina, and the menses was too early and dark clotted menses, and with along with pain in ovaries and frequent headaches, constipation, and hair fall and weight gain. And she came with the thyroid level. She came with the thyroid and the PCOD reports. Her thyroid level was 7.67, and hair fall and the weight gain are the common symptom of hypothyroidism. So I just went. Yeah, this is the report which she came on 12/4/2021 with the impression of polycystic ovarian appearance And on the blood report of the thyroid report, the same day, 12/4/21, her TSH level was 7.67. And with these symptoms, on concise repertory of homeopathic medicines by Dr. S.R. Pathak. On repertorization, a group of remedy came to me, and menses protracted too long, and vagina itching, ovary cystic, head pain, pressing, pressure, constipation. And this group is sulfur stands first in this group. Even sepia, platina, staphysaria, tuja, lycopodium, bryonia, and maxvomica. So I have a doubt whether we have to give sulfur or not. So I asked the patient, I asked the patient to tell about herself, and she told, I am having, and she was happy of having her own house, and I am happy about it. And she told that she was an average student and she was not interested in studies during her childhood, but at the same time wanted to be independent. And she scored 75% in the school, and for that her mom was very happy. And she was not interested in studies, but she was interested in a beautician course. Immediately after her schooling, she started her career at the age of 17, and now she is an assistant manager in a renowned beauty company. And she told that she was not forced by others, and she told that nobody forced me to work or study. And she has an elder sister and she got married. And she told that I have a very good understanding parents, and they are like almost like my friends. And she herself confessed that she was a very stubborn person and short tempered, and she never considered others opinion or others people's opinion. And she told, what I feel is right I will do, and I will not forgive anyone for the deliberate mistakes. And just while taking a case, just we have to observe the patient, what the patient tells and what again and again repeatedly she is telling, and do not interrupt while the patient is narrating. Once she finishes or once she tells all her complaints or about herself, and then we have to ask questions. And well, coming to the case, and she told she don't have many friends because of her straightforward nature, and she don't like continuing people who are jealous about her. And she told she was very close with the people who are genuine, and she likes good branded clothes, and I want everything to be customized however small it is. Even for example, she told it's an edited case. It took 2 hours, one and a half, more than 1.5 hours for me. And for example, what she told, for a small thing, for even buying a lipsticks, and she has to search the peculiar brand and peculiar shade. Doctor, I have all the shades, which is all shades are unique, which I have right with me. So I love cosmetics. And my sister scores about my love for costume, cosmetics and expensive things. So I like to finish work quickly. And also, about herself, and she is very independent and she's very stubborn. And I outrightly ignore people whom I don't like. And she is straightforward, and people think I have a big, and she herself confessed this, that who will tell like this, but she herself told that doctor, people think I have a big attitude. So, so I'm very picky in even in selecting things. Even for a top, she takes she searches in 10 shops or more than 10 shops to pick one top or which is unique. She wants everything in unique, and she um, and even take 2 days to buy a tiny thing. And if anyone uses my things, I'll never use it again. I want everything to be exclusive for myself, and I never allow anyone touch my things. I can't adjust with anyone. And she told initially she was a basic hairstyler, and people asked for the different styles which she don't know, and that was a crucial stage for her, and she wanted to be better and went for an advanced course. And she felt happy when her trainer appreciated her for her extraordinary skills. And she finished the course within 4 months. The course was actually 1 year, and she finished the course in 4 months, and she directly appointed as a senior expert by the trainer. And she was telling that my parents are proud of me, and I'm earning, and lot of stories also in between she told. And only she told about herself that I want to be like this, I want to do this, I'm very responsible, and my parents are proud of me, and I'm happy as they were understanding. And people spoke ill about me or on my back, which I never cared, and I asked them to face me directly if they were gutsy. And she's very bold enough, and she is very stubborn, and she talks straightly, and she talks directly, no matter who are they, and she speaks directly to them. And she quarrels, and even she quarrels directly with them in the workplace also. And she told a lot of examples. I did like this. And the most important thing in her life is her work. I'm very passionate about it. I want to mingle with people and relatives. And she told I don't like useless talks. I'm quick, clean, and I'm little bossy. I'll do smart work and not the hard work in my own way. I have to take responsibility of my team and also take important decisions. I need to solve the client problems. And because she was an appointed as an assistant manager, and she has to deal with all this. When I asked, what is your comfort zone? My comfort zone is doing what I like. I can't be forced even by my dad to do something which I don't like. I will not do. If they tell also, I will not do. And she told, I want everything in my own way. What I want to do, I'll do. What I like, I'll buy. If my friends and family do not agree, I will argue. And because of the work pressure, and she was always frustrated, and she don't like people ordering or bossing her, and she won't accept a bad service. For example, she told a lot of the examples, even in hotels, if the food is bad, and she will call that person who made it and tell them to eat and scold them in front of everybody and give bad reviews. And she will just forget them after scolding them. And she likes to spend a lot of money, and she will buy expensive things. Mm, Usually I won't interrupt in between asking questions. But finally, I'll ask once the patient's finished. I'll ask the questions. I uh, make a note of questions what to be asked, and then finally I will ask. In this case, and she told that I spent a lot of money buy expensive items, and I once went to a bank This is small examples, lot of examples she told. And I once went to a bank and wanted to open a senior citizen account for my parents. And the executive said, and she would open one and said they would issue a debit card with no annual fee, something. And but when the annual fee was deducted in spite of her promise, and I complained to the manager and made her come to my home and apologize. I did not give up until my annual fee was reversed. After case taking, she had a lot of questions. Doctor, how long it will take to thyroid for the treatment of the thyroid or PCOD, and what are the side effects and what will happen? And she had a lot of questions, and not even she told a doctor, and she told directly Mamtha like that. She called me, and I took these rubrics in Fatak Repertory. Menses protracted too long, insolent, rude, haughty. We can see here sulfur, platina, veratrum album. Even sulfur is there, platina is there, veratrum album is there. And menses protracted too long. You can see calcarecar, bucrum, lycopodium, naxomica, natrum, phosphorus, platina, sorinum, pulsatilla. And I asked law at last. Um, for here, she told about herself, and in the whole case history, I could not find any issues of me versus you, or somebody is doing something to me, and she is very bold and she is very stubborn, and I could not find any symptoms related to an animal kingdom. And even and I asked why you are having that beauty, why you are interested in beauty, and you like peculiar things. That means you want to be unique. Why I asked, actually, she told I want um, something different. I want unique, and there is no. I don't think about others. But if I want a good product, a branded thing, I want that. If I like that, I want that. I want to put. And my selection is totally different and it should be unique because I like that. And here there is no issues of attractiveness or like that. That I could not find out any such issues. And while coming to the mind rubrics, the cross reference, mind delusion appreciated she is not, and mind ailments from disappointment, honor wounded or scorned being, egotism, sadness, anxious, mind casting of people against her will. A very good important rubric. And mind delusions, looking down, he were looking high place from a high place. He were looking from a high place. These are the cross references. So I went to the repertory session. I took female menses protracted, prolonged, and mind, haughty, pride, and female tumor cyst ovaries. And here we can see that platina covers 3 symptoms with 12 marks, and next is the lycopodium and lachesis. And rest and all, it's like 7/3. So here, which remedy to give? So, as we understood from the case taken here, in this case, I could not find any sensitiveness, and she herself confessed that I'm very strong, I'm very bold, I'm straightforward, I'm little bossy, and there is if we think of lycopodium, there is no cowardice. Even haughty pride is there in lycopodium, but a little bit cowardice will be there, and they want to prove themselves. The plant sensitiveness, I could not see any plant sensitiveness in this case. And while coming to lachesis, and there is no issue of an animal issue. That means if we think of an animal kingdom, there is No issue of me versus you, or somebody's doing something to me, or any fears. So platinum. So we can think of these three remedies. Out of these three, platina, we can think of platina because of her. There is no issues that there were something lacking or losing, or I don't have, I want that, I want this. And only thing she wanted to be beautiful dresses in coming to the dress part and the beauty part. And she wants everything to be unique. Everything to be unique. And after repertorization, and furthermore rubrics I took: mind, haughty, pride, female menses protracted, prolonged, and female tumor cyst ovaries, female congestion ovaries, female irritation ovaries, female menses same early, too frequent, prolonged, protracted. So out of this again, platina, tuja. Tuja is also a very good remedy for ovarian cyst, and but tuja belongs to plant kingdom. And lilium tick is a plant, lycopodium, same. The sulfur is a mineral, again lacus is an animal kingdom. And so I finally, so after repertorization, so I want this remedy, whether to give this remedy or sulfur with reference to our materia medica. So I went to the keynotes of Allen's keynotes, and in under platina, I've studied that adapted to women dark fiber who suffers from too early and too profuse menses, and especially this is very, very important. And in platina, is this especially acts on sexual organs. Hysterical from uterine disease, headaches, numb, heavy pain in brain or in vertex, dark clotted offensive, constipation while traveling, and menses too early, too profuse, too long lasting. Even in this symptom you can see in sulfur also, menses too early, too profuse, too long lasting. But sulfur we think of a most of male remedy, and the platina belongs to the female remedy, but at times we have to match the exact remedy whether they are male or female. And Materia Medica by William Borick, referred in Borick, it's preeminently a woman's remedy. Strong tendency to paralysis, spasm, pain increases and decreases gradually. Mind, irascible impulse to kill, but contempt for others, arrogant, proud, weary of everything. So here again, in female complaints, menses too early, too profuse, dark clotted, pruritus vulvae, ovaritis. So we can come to the conclusion in a selection of remedy. Yeah, I gave her platina 200 one dose, and after 1 month her thyroid levels was same, no improvement. And platina next after 1 month, so platina 1m 1 dose. I gave her platina 1m 1 dose. So after the month of July, 21 July 2021, her TSH level was 4.48. So in a in a case after repertorization, even genus of remedy, we can come to the conclusion now. Genus of remedy or even keynote symptom, kingdom analysis, organ affinity. Platina, you know all, it's a main organ of the female sexual organs, the affinity of the drug. We all know well. So we can come to the conclusion that this place, even genus of the remedy, kingdom analysis, keynote symptom, and organ affinity plays an important role in selection of specific remedy after repertorization. So I hope all you enjoyed the video, and thank you. Once again, I thank Dr. Sir Kalatia sir, and thanks to